knock.
Hello.
Hey, how are we doing today?
I'm doing good. How are you?
Good. My name's Katie. I'll be your nurse and your baby's nurse today.
Okay.
I'm just going to do a little assessment on your child today. What's his name?
His name is Joshua Jerome.
That's a pretty name. Does he have any allergies or any kind of skin conditions or anything?
Nothing so far.
Alrighty. Okay, so first we're going to measure his head circumference, see how much his head has grown. Just going to gently lift his head up. Right, about 37 centimeters. Okay, so I'm just going to measure his length, starting at the top of his head down to his legs. Right, about 53 centimeters. All right. Next, I'm just going to put some gloves on. I'm going to weigh your baby. We're just going to take his diaper off and his little hat off really quickly. And I'm just going to make sure to assess his bottom while I'm over there so I don't have to take his diaper off again. All right. Alright, we're just going to make sure the scale is zeroed out, then place him down. Alrighty. So we're just going to bring little Joshua back over here, get him a new diaper. Is he having any skin issues, Mama? Like any kind of irritation or?
Sometimes he'll get dry, but they gave me some
lotion for him.
Yeah, and he's been doing really great.
Alrighty. Does his head look okay? I don't see any lesions or mites. His hair looks really good for his age. Hat back on. All right, his mom helped him put his little hat back on. Okay, so the rest of his skin looks good. All right, now I'm just gonna take his temperature. All right, and we're just gonna put this under his arm. And while I'm doing that, I'm just gonna count his respirations for a full minute to make sure his breathing is accurate. All right, he's got a good temperature of 98.7, and then his respirations are around 35. All right, so that looks good. Has he had any breathing problems lately?
Everything seems okay.
All right, so we're just gonna listen to his heart and lung sounds really quick. Does he have any kind of heart issues, any congenital defects, Mom?
No, not that I know of.
All right, any history of hypertension or anything like that while you were pregnant?
No, ma'am.
Right, this might be a little cold. All right, now we're just gonna listen to his heartbeat for 1 full minute. All right, it was 120. All right, and his heart sounds and lung sounds good. I'm gonna look into his ears, make sure everything looks okay. His eardrum looks intact. He doesn't have any lesions or drainage or pus or anything like that. I'm gonna turn his little bed around. All right, and look in this ear. No drainage, no pus. Looks good. Alrighty. Now I'm gonna look in his nose. Just pull it up just a little bit. Just make sure there's no drainage or redness. Make sure the color looks okay. His nose is symmetrical. I'm gonna look in his mouth. He would have teeth right now if he was a little bit older, but he's too young for that. All right, and then make sure he can follow the light with his eyes. All right, those all look good, Mama. So I'm just gonna feel on his chest just to make sure it feels good and there's no deformities with his breathing. He's breathing with his abdomen, not his chest, so that's good for this age. I don't feel any deformities or anything, and it looks like he's breathing symmetrically. All right, and then for his cap refill, for his cardiac function. All right, it looks like he's got good flow to his fingertips. Check his toes. Good blood flow to the fingertips and toes. All right, so now I'm just gonna feel for his heartbeat. His skin looks appropriate for his ethnicity. All right. Are there any kind of heart defects or anything like that in his background, Mama?
No.
All right, and does he feed without tiring?
Yes, he does.
All right, and does he become blue at all in color when he feeds or
Everything
eating?
looks good.
All right. So next I'm just gonna examine his abdomen. I'm just gonna look at it from a couple different angles to make sure it looks good. All right. So now I'm just gonna listen to his bowel sounds. All right, he sounds nice and hungry. Do you breastfeed him, Mama, or do you?
I mainly breastfeed.
All right, and how often do you feed him a day?
Whenever he gets hungry, but it's normally like 2 to 3 hours.
Okay, and then have the feedings been going well?
Yes, he latches on great, and he eats until he's full, and then he sleeps.
Okay, so it looks like your baby's arms are moving just fine. He's got good leg control, and his muscles feel like they're appropriate for his milestone.
That's good.
All right. So we're just gonna assess a couple nerves to make sure they work. I'm just gonna check and make sure that your baby roots around fine. All right. That's just good. Make sure his sensation is good. Looks like his face moves towards my fingers. All right, just make sure he is sound. Make sure his head moves over this way. All right, and then just make sure that his grip is good. Oh, he's got a little mighty grip, Mom. All right, and then just check his reflex. His feet should, or his toes should fan outwards. That one's good. That one's good as well. All right, and did you have any questions, Mom? It looks like your baby's nice and healthy and on track for his milestone group.
That's great. Nope, he's good. I'm good.
All righty. Thank you, Mom. You and little Joshua have a good day.
Thanks.
And I'll document all this in Joshua's chart.
Thanks.